mild dryness. Zinc supplements taken orally may reduce acne severity, particularly in people who are zinc deficient. Zinc plays roles in immune function, wound healing, and anti-inflammatory processes. Studies show mixed results, but some demonstrate zinc supplementation improves acne, particularly in conjunction with other treatments. Typical zinc supplementation for acne is 25 to 50 milligrams daily. However, excessive zinc supplementation can cause nausea and copper deficiency, so don't exceed recommended doses without medical guidance. Consult your doctor before starting zinc supplements, particularly if you take other medications. Niacinamide, vitamin B3, is a natural compound with antibacterial, anti-inflammatory, and sebum-regulating properties. While available in supplements, topical niacinamide is more relevant for acne. Many skin care products now include 4 to 5% niacinamide. Studies demonstrate that niacinamide reduces sebum production and acne lesions with minimal irritation. It's suitable even for very sensitive skin and works well alongside other treatments. Azelaic acid, a naturally occurring compound found in grains like barley and rye, has proven antibacterial and anti-inflammatory properties. It's more commonly available as a prescription medication, Azelaic, Phenacea, or in over-the-counter products, but azelaic acid is naturally derived. It's particularly effective for post-inflammatory hyperpigmentation and rosacea-related acne. Dietary changes based on research can improve acne. Eating antioxidant-rich foods like berries, dark chocolate, and colorful vegetables reduces inflammation throughout your body, including your skin. Omega-3 fatty acids from fish, walnuts, and ground flax seeds have anti-inflammatory effects and may reduce acne. Increasing fiber intake through whole grains and vegetables improves digestion and may improve skin. Reducing sugar and refined carbohydrates reduces blood sugar spikes that worsen acne. Hydration deserves special mention. Drinking adequate water, about 8 to 10 glasses daily, maintains skin hydration from within, supports detoxification, and promotes overall skin health. While water alone won't cure acne, adequate hydration is fundamental to clear skin. Sleep is profoundly important. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves skin health and acne. Stress reduction through meditation, yoga, deep breathing, or regular exercise reduces cortisol and inflammation, directly improving acne. Chronic stress is a well-documented acne trigger. Even 10 to 15 minutes of daily meditation or yoga can measurably improve skin. Important limitations of natural remedies. Most natural remedies are suitable for mild acne only. If you have moderate to severe acne, particularly cystic acne, natural remedies are insufficient and you require professional treatment. Natural remedies work best alongside professional treatments, not as replacements. Natural doesn't automatically mean safe or effective. Many natural substances are irritating or ineffective for acne. Finally, natural remedies require consistent use for 4 to 8 weeks to demonstrate effectiveness. Don't expect immediate results. Guide 9. Spot Treatment Mastery, Targeted Acne Lesion Treatment and Prevention. Spot treatments allow you to apply potent acne-fighting ingredients directly to individual pimples, minimizing exposure to surrounding healthy skin. Mastering spot treatment techniques accelerates healing and prevents scars. Understanding when and how to use different spot treatments is essential for optimal results. Timing is everything with spot treatments. The most effective time to treat a pimple is at the earliest sign of its formation. Many people feel a small bump developing under their skin 1 to 2 days before it becomes visible. Applying spot treatment immediately when you feel this early bump can prevent it from fully developing. If you notice a pimple just starting to form, small, red, not yet inflamed, beginning treatment immediately can prevent significant inflammation and reduce healing time by days. Different pimple types require different treatments. For small whiteheads or pimples with visible centers, spot treatments with salicylic acid effectively flatten the pimple and accelerate healing. Apply a salicylic acid spot treatment directly to the whitehead using a clean cotton swab or applicator. For closed comedones or small flesh-colored bumps, salicylic acid is also most effective. For inflammatory red pimples without visible centers, benzoyl peroxide is more effective than salicylic acid. For large, painful, deep cystic acne, neither topical spot treatment alone is sufficient. These require professional dermatologist intervention. Intralesional steroid injections are highly effective for cystic acne. Preparation is important. Before applying any spot treatment, cleanse the area thoroughly to remove makeup, dirt, and oil. Pat the area dry completely. Applying spot treatments to damp skin reduces effectiveness and increases irritation. Wait a full 2 to 3 minutes after cleansing to ensure complete dryness. When applying spot treatment, use a clean applicator. Never apply with your finger as this spreads bacteria. Cotton swabs, disposable applicators, or sterile tools are appropriate. Apply a small amount directly to the pimple, covering just the lesion itself and a tiny bit of surrounding skin. Using too much spot treatment wastes product and irritates surrounding healthy skin. Spot treatment frequency depends on the product and your skin's tolerance. Salicylic acid spot treatments can typically be used twice daily, morning and evening, if your skin tolerates it. Benzoyl peroxide spot treatments should typically be used once daily initially, preferably at night, then increase to twice daily if your skin adapts well. Some very potent spot treatments are meant to be used only once or twice weekly. The less is more principle applies to spot treatments. Using more frequent applications or larger amounts doesn't accelerate healing, it only increases irritation and dryness. Consistent, moderate use is more effective than aggressive over-application. Never pick, squeeze, or extract pimples yourself unless absolutely necessary. Squeezing ruptures the follicle wall, pushing bacteria, sebum, and dead skin cells deeper into the skin. This spreads the pimple, increases inflammation, and significantly increases scarring risk. Additionally, using your fingers spreads bacteria to other areas of your face, causing more pimples. If a pimple has a visible white center and you feel you must extract it, use a professional extraction tool or, ideally, have a dermatologist perform professional extraction. If you do extract a pimple, do so properly. First, apply a warm compress for 10 minutes to soften the plug and open the pore. Use a sterile lancet or extraction tool, available at pharmacies or dermatology offices, to make a tiny puncture or use an extraction loop to gently apply pressure around the pimple. Never use fingernails. After extracting, immediately apply an antiseptic and then an acne treatment. This approach minimizes the damage compared to aggressive squeezing. Acne patches are an excellent spot treatment innovation. These hydrocolloid bandages, infused with acne-fighting ingredients like salicylic acid, are applied over pimples. They absorb pus and oil from the pimple while protecting it from external bacteria and irritation. Acne patches work best on surface pimples with visible centers rather than deep cystic acne. They're typically left on for 6 to 8 hours or overnight, providing results within 6 to 8 hours to overnight for responsive pimples. Many people use acne patches under makeup during the day or overnight. They're convenient, visible results-oriented, and non-irritating. Pimple patches containing active ingredients like salicylic acid, benzoyl peroxide, or tea tree oil are superior to regular hydrocolloid bandages. However, regular hydrocolloid bandages provide some benefit through moisture management and protection even without active ingredients. Spot treatment serums and gels remain on your skin, typically used twice daily. Apply after cleansing and before moisturizer. Common spot treatment actives include benzoyl peroxide, salicylic acid, azelaic acid, and sulfur. Choose based on your pimple type. Inflammatory acne responds better to benzoyl peroxide, comedonal acne to salicylic acid. For very aggressive spot treatment, some dermatologists recommend combining low concentrations of different actives, perhaps a small amount of salicylic acid followed by a small amount of benzoyl peroxide on the same pimple. However, this should only be done if your skin tolerates it well and should be used sparingly. For most people, one spot treatment at a time is appropriate. Sulfur spot treatments are often overlooked but can be highly effective, particularly for inflammatory acne and sensitive skin. Sulfur has been used in dermatology for over a century and has proven antibacterial and anti-inflammatory properties. Some people find sulfur more tolerable than benzoyl peroxide or salicylic acid. Intralesional steroid injections administered by dermatologists are the gold standard for large, painful cystic acne. A small amount of steroid is injected directly into the cyst, causing it to deflate and heal within days. This prevents the cyst from persisting for weeks or months and significantly reduces scarring risk. If you have large cystic acne, ask your dermatologist about this option. Common mistakes with spot treatments include starting with too strong products, using them too frequently, using too much product, expecting overnight complete resolution, or abandoning consistency after just a few days. Spot treatment works best with realistic expectations. A moderate pimple treated consistently for 3 to 5 days should flatten and improve noticeably. Large cystic pimples take longer and may require professional intervention. Guide 10. Strategic moisturizing for acne-prone skin, hydration without triggering breakouts. One of the most common and damaging myths about acne is that people with acne shouldn't use moisturizer. This myth causes countless people to have dry, irritated, sensitive skin that's actually more prone to acne. Proper moisturizing is absolutely essential for acne-prone skin, and understanding how to moisturize without clogging pores is critical. The reality is that acne-prone skin, especially if you're using acne treatments, desperately needs moisturizer. Here's why. When your skin is dehydrated, it compensates by producing more sebum. This excess sebum actually worsens acne. Additionally, most acne treatments, salicylic acid, benzoyl peroxide, retinoids, cause dryness and irritation. Using moisturizer counteracts these side effects, allowing you to continue treatments without excessive discomfort. Finally, properly hydrated skin has a stronger barrier function, which improves overall skin health and actually reduces acne. The key to moisturizing acne-prone skin is selecting appropriate products. Look for moisturizers specifically formulated as non-comedogenic, meaning they don't clog pores.
Chán rồi xong. cái gì hết cho nó rồi. Rồi chúng ta nhìn nó sót nó xem. Có gì xíu nữa nè. Kiểm cho cái má. Rồi. Có mấy nốt nữa thôi. Cán luôn cho nó sạch nha.
Welcome, and breathe deeply with me. Let yourself settle into this moment of learning. Today we're going to explore the different types of sunscreen and help you find the one that works best for your unique skin. Sunscreen is the single most important skincare product you can use. No serum, no cream, no expensive treatment will do more for your skin's health and appearance than daily sun protection. Understanding the different types helps you find one you'll actually want to wear every single day. There are two main categories of sunscreen: chemical, also called organic, and physical, also called mineral or inorganic. Both protect your skin from UV radiation, but they work in completely different ways. Let's start with physical sunscreens. Physical sunscreens contain mineral ingredients, zinc oxide, titanium dioxide, or both, that sit on top of your skin and physically reflect and scatter UV rays away from your skin. Think of them as tiny mirrors on your skin's surface, bouncing harmful rays before they can penetrate. The advantages of physical sunscreens are numerous. They work immediately upon application, no waiting time required. They're less likely to cause irritation, making them ideal for sensitive skin, rosacea-prone skin, and skin that reacts to chemical sunscreen ingredients. Physical sunscreens are photostable, meaning they don't break down in sunlight. They provide consistent protection throughout your wear time. They're also reef safe, Zinc oxide and titanium dioxide don't harm marine ecosystems, unlike some chemical filters. For people with sensitive eyes, physical sunscreens are gentler. Chemical sunscreens can sometimes migrate into eyes and cause stinging. Physical barriers stay where you put them. However, physical sunscreens have downsides. Traditional formulas leave a white cast, that chalky, ghost-like appearance, because the mineral particles are large enough to reflect visible light as well as UV light. This is particularly problematic for medium to deep skin tones, where the white cast is very visible and unnatural looking. Physical sunscreens can also feel thicker and heavier on the skin. They may sit on top rather than absorbing, creating a textured, sometimes greasy feel. They can also emphasize dry patches or texture. Modern formulations have improved significantly. Micronized or nano-sized mineral particles reduce white cast while maintaining sun protection. Tinted physical sunscreens help offset the white cast. Elegant formulations with silicones and other ingredients improve texture and wearability. If you choose physical sunscreen, look for micronized formulas. Consider tinted versions if white cast concerns you. Shake the bottle well before applying. Minerals can settle. And be patient with application. These formulas need gentle, thorough blending. Now let's explore chemical sunscreens. Chemical sunscreens contain organic compounds, avobenzone, octinoxate, octosylate, octocrylene, homosilate, oxybenzone, and others that absorb UV radiation and convert it into heat, which is then released from your skin. Think of them as sponges that soak up UV rays and neutralize them. The advantages of chemical sunscreens include their cosmetic elegance. They absorb into your skin, leaving no white cast regardless of your skin tone. They feel lightweight, often almost invisible. Modern formulations can be nearly indistinguishable from regular moisturizers in texture. Chemical sunscreens are easier to formulate into high SPF products, makeup, and multifunctional products. They blend seamlessly with other skincare ingredients. For people who want sun protection that feels like nothing, chemical sunscreens excel. However, chemical sunscreens have considerations. They need time to absorb and bind to your skin, about 15-20 minutes before sun exposure. If you apply and immediately go outside, you're not yet protected. Some chemical filters, particularly avobenzone, are not photostable. They break down in sunlight, reducing their effectiveness over time. That's why reapplication is crucial with chemical sunscreens. Chemical sunscreens are more likely to cause irritation or allergic reactions in sensitive skin. Ingredients like oxybenzone are common irritants. They can also sting if they migrate into your eyes, which can happen when you sweat. There's also environmental concern. Some chemical filters, particularly oxybenzone and octinoxate, harm coral reefs and marine life. Many locations now ban sunscreens containing these ingredients. If you choose chemical sunscreen, look for newer, more stable filters like 𝒓𝒆𝒄, tinosorbas, or Uvinol A+. These are more common in European and Asian sunscreens. Apply 15 to 20 minutes before sun exposure. Reapply every 2 hours diligently, especially if you're sweating or swimming. Consider reef-safe formulas if you'll be in ocean waters. Then there are hybrid sunscreens that combine both physical and chemical filters. These formulas attempt to capture the benefits of both types while minimizing the downsides. They might use zinc oxide for UVA protection, plus chemical filters for UVB, creating broad-spectrum coverage with better cosmetic elegance than pure physical sunscreen, but potentially less irritating than pure chemical formulas. Beyond the physical versus chemical distinction, sunscreens also differ in their additional properties. Some sunscreens are water-resistant, maintaining their SPF for 40 or 80 minutes while swimming or sweating. These are ideal for active lifestyles but can be harder to remove at day's end, often requiring oil-based cleansing. Some sunscreens are tinted, providing light coverage while protecting. These can replace or work under foundation, and the tint helps counteract any white cast from physical filters. Some sunscreens are formulated specifically for faces, with elegant textures designed to work under makeup. Others are body sunscreens, often more affordable per ounce but with heavier textures unsuitable for facial use. Some sunscreens are designed for specific concerns: mattifying formulas for oily skin, hydrating formulas for dry skin, fragrance-free for sensitive skin, or formulas with added skincare ingredients like niacinamide or hyaluronic acid. So how do you choose your sunscreen? Consider your skin type first. Oily skin typically prefers lightweight chemical or hybrid sunscreens, especially those labeled mattifying or oil-free. Gel formulas work wonderfully for oily skin. Dry skin often loves physical or hybrid sunscreens with moisturizing ingredients. The slightly richer texture provides sun protection and hydration together. Sensitive skin usually does best with pure physical sunscreens or gentle chemical filters, always fragrance-free. Consider your skin tone. Fair to light skin can often use any sunscreen type. Medium to deep skin tones should prioritize products specifically tested on deeper skin, or seek tinted formulas if using physical sunscreens. Invisible or universal tint formulas work across many skin tones. Consider your lifestyle. If you're very active, outdoors frequently, or swimming often, prioritize water-resistant formulas with higher SPF. If you're mostly indoors with occasional outdoor exposure, any broad-spectrum SPF 30+ daily moisturizer sunscreen might suffice. If you wear makeup, choose a sunscreen that works well under cosmetics, usually chemical or hybrid formulas with elegant textures. Consider your values. If environmental impact matters,
Nhiều này cô. Rồi, ok. Xong rồi đó. Em đang đi học hay đi làm rồi?
Dạ đi học.
Chắc là đang học đại học đúng không?
Dạ.
Rất là nhiều mụn ẩn luôn nha. Mụn này em cũng xử lý kịp, đó là nó bị viêm, nó để lại sẹo rỗ nè em. Em đã đi lấy mụn lần nào chưa?
Dạ rồi.
Mụn ẩn không đây? Nhìn sát qua gì vậy? Nó nhìn sát qua. Cố gắng xíu em nha. Mụn ẩn rất là nhiều luôn. Cố gắng xíu. Dạ, cái cục nó viêm quá viêm luôn rồi. Dùng một lần mình bỏ nên con yên tâm nha. Đây này đèn mới hả? Con học lớp mấy rồi Lệ? Con học lớp mấy rồi?
Học lớp 7.
Cố gắng xíu ha. Cố gắng đừng nhúc nhích con. Hai mẹ con là ở quận mấy?
Dạ, em ở hai bên đường Lê Đức Thọ.
Lê Đức Thọ hả chị? Lát nữa hả em cho cái thuốc á, chị về chị mua cho cháu uống.
Dạ.
Nó sẽ hết á. Thông thường là nếu mà chị bên ngoài không hết thì mình uống thêm bên trong á chị.
Dạ.
Chị này là cô của cô Trúc á chị.
Hả?
Chị này là cô của cô Trúc á. Trúc là các bạn lần trước em trong trong.
Dạ. Cố gắng một xíu con. Bôi thuốc, uống thuốc rồi rửa mặt sạch. Hạn chế thức khuya. Cái tuổi của con nó đang dậy thì á. Rồi lâu lâu đi lấy mụn. Cho mai mốt cái mặt của mình nó sẹo hết, thấy không? Mụn này nó không có tự tiêu được, mai mốt cái mặt nó sẹo, nó rỗ hết. Nó lỏng rồi, đừng có nhăn quá. Mụn dày vậy là chỉ có uống thuốc thôi, thuốc nó mới bớt cái gì. Mụn này quá dày, lấy không thể nào lấy hết được. Nó dày mà nó nhiều lớp á, dày hơn cái mặt luôn. Tại thức khuya nó sẽ bị lên mụn ẩn á vậy. Chị nhắc nhở cháu. Mụn này dày quá trời. Mấy cái nốt cục bự bự trên trán là nó bị viêm á chị ạ. Thở lỏng ra con cố gắng xíu. Để mốt cái mặt nó rỗ hết, mẹ thương là mẹ mới dắt đi lấy mụn nè. Chị Trúc giới thiệu qua đây hả chị?
Dạ.
Bạn Trúc giới thiệu qua đây đúng không?
Dạ, Trúc giới thiệu.
Dạ. Rồi cố gắng lên nha. Cục bự bự không nè.